Nice hair.
Oh, thank you. I like your hair too. Okay.
Name, social, wallet.
My what? My wallet.
Arm, please. Look at these veins, sir.
Hey, what are you doing? What is wrong with these people?
Really?
Oh my gosh.
Hi, I'm Dr. JB. How may I help you?
Wait, if you're the doctor, who are all these people in my room? Who are all these people in my room?
These people?
Yeah.
They're my team. Dr. JB in the house. Dr. JB in the house. Dr. JB in the house. Dr. JB. Dr. JB. Dr. JB in the house. 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 Dr. JB. Dr. JB. Dr. JB in the house. Hi, everybody. Welcome back to my YouTube channel. Thanks for tuning back in. A few weeks ago, I created a video talking about why am I waiting so long to be seen? And during that video, I made mention about the team in the emergency department. Well, today's video, we are going to be talking in more depth about what that team is and who are the members of that team. The size of that team may depend on where you're receiving your care. If you're receiving your care at a major academic center, the size of that team might be a lot bigger than if you are in a small community hospital. So we are going to start this conversation by talking about just an average size community hospital. Not too small, also not too big. And then we'll go into some details about exceptions to what I'm talking about. So at your average community hospital, and a community hospital essentially is a hospital in the community. It is not affiliated normally with a academic institution, meaning that there are not any learners there. So there's no medical school associated with it or any kind of residency program. So oftentimes the people who will be interacting with you while you're in the hospital are people who have completed all of their training. There are exceptions to the rules. Sometimes different medical schools or other health professional schools will contract with local community hospitals to allow their students to do an elective, meaning a 3 or 4 week or maybe even 6 week stint in the community hospital to get a feel for what life in the community is if you were to go ahead and practice medicine in the community. But on the whole, you won't run into learners when you're at a community hospital. So often when you come into the emergency department, one of the first people you'll see is someone working in registration or a tech and or a nurse. Usually the person in registration will take down your information like your name, your address, whether or not you have insurance, and just get a sense of why it is that you're here. Oh, I'm coming in with abdominal pain. The nurse that's out front, called the nurse in triage, is responsible for keeping an eye on what's happening in the waiting room as well as getting your vital signs when you come into the emergency department. Similar to, what I mentioned in Why Am I Waiting So Long to Be Seen? You are not seen in order of arrival in the emergency department, but in order of acuity or how sick you are normally. That means that even though you've been waiting 2 hours to be seen, as somebody who is sicker, meaning their vital signs are or abnormal, or they have a life or limb threatening condition, which is extremely time sensitive, they're going to jump the line. And so oftentimes that is caught by the triage nurse. And so she'll go ahead and get your vital signs and put them in the computer. And then either, if there's a bed available, bring you back to the main section of the emergency department or the fast track area of the emergency department, or you'll be put back in the waiting room to wait. When it is time for you to be brought back into your room, oftentimes there will be a ER tech who will help escort you back to your room. So they will be the ones that will oftentimes put you in the wheelchair and wheel you to your room. Sometimes if you come in and you're having chest discomfort, it's the ER tech who will do the EKG of your heart so that the doctor in the back can evaluate it and make sure you're not having a heart attack. And if you are having a heart attack, identify it and act on it as quickly as possible. So the ER tech will transport you back into your room. Oftentimes they will work with the nurse to make sure that you get put in your gown, connected to the monitor if you need to be connected to the monitor, and they will basically assist the nurse in anything that they may need. Then you will have your own primary nurse who will be responsible for your care once you're in the main section of the emergency department. So that nurse will be the one that will oftentimes get your blood work. They'll start your IV line, get your blood work. They will be getting all the medications that you need, that your doctor has prescribed for you, or if there's medications that you normally take at home that you need to take because they're timed or whatnot, that nurse would be the one who would notify your doctor of whatever it is that you need. If you need assistance getting to the bathroom or getting changed out of your clothing, oftentimes that will either be your nurse or ideally the tech, or in some situations if there's a nursing assistant who assists the nurse, they would be the ones that would help you with most of those things. Although I'm listing out things that these different team members do, that is not this list is not all inclusive, nor do people necessarily have to stay within their own specific lane, meaning that your physician can get you connected to the monitor if for whatever reason your nurse or the tech is tied up. During our training in medical school, we were taught to do all of the above. So we can connect to the monitor, we can get your IVs. Oftentimes the doctor is called in to your room to help get an IV going for you if the nurses have difficulty with it. So I jumped ahead. The doctor. And so the doctor is really the head of the team. And so they, depending on where you're at, so if I'm talking about an average size emergency department in the middle of the day, oftentimes they'll have more than one doctor or health provider working at the same time. When I talk about healthcare providers, I'm talking about nurse practitioners, physician assistants, or physicians. Also, your physician, nurse practitioner, physician assistant, nurse, tech can be any sex. So just because they are female does not mean that, oh yeah, they're my nurse. They could be your doctor. They could be your tech. Similarly, just because they're male doesn't automatically mean that they're your doctor. They could be your nurse. They could be your doctor. They could be your tech. They could be in registration. And so the one thing you need to keep an eye out for is their name. Every healthcare professional working in the hospital in general, and also in the emergency department, but anywhere in the hospital, they will have a name badge and they need to introduce themselves when they walk into your room so that you can understand who they are and their role. So as your doctor, right, who's the head of the team, they will come in and do their own assessment, and then they will be the ones that'll be putting in the orders for anything that you may need, any blood work that you may need, any imaging that you may need, and ultimately make the final decision once they have everything back, combining your story, whether you need to be admitted to the hospital or whether they recommend that you get admitted to the hospital, or if it's okay for you to be discharged home to follow up with your primary care physician. So traditional community hospital, you'll run into the registration. The registration will come in, you'll see them in the front, and then you may see another one once you're actually in your room, and they're the ones that help keep the lights on, right? So they go ahead and collect your insurance information or your payment if you choose to pay during your stay in the emergency department, or you can get billed at a later date. So that's registration. And then the tech is the person who will oftentimes do your EKGs. They will help transport you back to your room. They'll help get you connected to the monitor, get you in the gown, help escort you to the bathroom if you need it. They can be the ones that can go ahead and get any kind of food if it's okay for you to eat. Oftentimes your tech or your nurse or even your doctor will be the ones that will be able to get that for you. And then you have nurses. You have the nurses that are in triage that keep an eye on the waiting room, making sure everybody's okay, and then get at people's individual vital signs and help determine who needs to be brought back right away versus who can wait a little bit longer. And then you have your own individual nurse who gets your blood work going, gets you your pain medications, gives you any of the treatments that your doctor recommends. And then we have other staff, in addition to what I just mentioned, who can intervene and help when needed. For instance, we have respiratory therapists who help with breathing treatments if you're struggling to breathe, and they can go ahead and help with intubations if we have to put a tube down your throat. We have our x-ray techs that come in and they help. They do the x-rays either at the bedside or they bring you to their department and get the x-rays. We have our CT techs who get your CTs going. We have an MRI techs in the very rare situation that we actually get an MRI for you in the emergency department, that they would be involved in your care. We have laboratory who runs your blood work. And so we all work together as a team. And when all of us are working smoothly and efficiently, things go great. But sometimes things don't go great because sometimes, a machine is down in the lab or we're short-staffed and so people are stretching themselves thin and things are taking a lot longer to be accomplished than ideal. So that's the community setting. If you're in a small community hospital, so instead of several providers, meaning physicians, physician assistants, and nurse practitioners being on at the same time, you might only have one that's responsible for the entire emergency department. And so the amount of people working at one time will be diminished depending on the size of the emergency department that you're in. If you're at a major academic center, then not only will there be more staff working at one time, but also you will get introduced to the learners. And so a lot of patients will roll their eyes when you get introduced to medical students or residents. But did you realize that the doctors and other healthcare professionals that are taking care of you today were once learners? And that if learners do not have the opportunity to learn and master their skills, then who's going to go ahead and take care of you when you get older and actually need care? So it's important to give learners a shot, a chance. Oftentimes, learners are even more careful and more meticulous than people who've been doing it for forever, right? Because they're like, I've been doing this for forever. I can do this in my sleep. Meanwhile, the learners are like, oh no, I need to be very careful. If you get cut and you need to be sutured up or your cut needs to be sewn back together, oftentimes the learners do a much better job than people who've been doing it for forever. People who've been doing it forever, they go quick, quick, quick. The learners are very meticulous and they take their time to do everything just right. So give them a shot, because all of us were learners. So when you're at a major academic institution, oftentimes there'll be a lot of people that come by and get your story. So you'll have the medical student who comes by and sees you. You may have a first or second year resident who's early in their training who will come by and see you. Then you'll have a senior resident who may come by and address some other components of your story and make sure they got it correctly. And then lastly, you'll have the physician, also known as the attending physician, who is responsible for all of those learners. Oftentimes, when the attending physician comes by and sees you, they're not going to go through all the details of your story unless there's a teaching point that they want to make sure that the learners who are working with them that day understand. Usually they'll just summarize it, because by then, right, you would have been seen by at least 3 other health professionals prior to them coming to see you. And so besides that setup of learners and supervising learners and attendings, the other supporting staff is very similar. They may also have their own students also. So the nurses may have nursing students. The physician assistants may have physician assistant students, etc., etc. Hey, it's an academic institution. It's a learning center. When you're nearing the end of your stay in the emergency department and we've gotten back all of the information that we need to be able to make a decision in your academic institution, right? Your attending physician will review everything and make a recommendation about whether you should get admitted to the hospital or if it'd be safe for you to be discharged. If you get admitted to the hospital, guess what? This process starts all over again, because depending on where you get admitted to, be it the general medical service, right, or surgical service, they all have their learners. So this summarizes in broad strokes the different healthcare professionals you may encounter during your stay in the emergency department and their responsibilities. Again, this was not all inclusive, and again, nobody has to stay according to their lanes. I mean, there are certain things that only specific specialties or categories of healthcare professionals can do. For instance, the physician is the one that's going to be putting in orders for your medications. So while you may find that some hospitals, some nurses may be able to put in some orders to get things going for you, some basic blood work or some basic types of imaging. Oftentimes the physician is the one that will have to sign off on everything that the nurses or the other health professionals, meaning nurse practitioners or physician assistants, do. The physicians, although they put the orders in for your medications, they're not the ones that go in and get the medications. There is a clear division of labor. And so that's why sometimes your doctor will be like, yeah, the medication's been ordered for you. The nurse will get it, and the doctor's not going to come back with the medicines and give it to you. Clear separation. And the nurses will give you medications. The techs will not give you medications. The techs cannot even get the medications to give you. In some situations, the techs are able to get blood. Other hospitals, not so much. It really just depends. And then identifying who is who, forget about it. Because there is a rainbow color of scrubs, and it really just depends on where you are. Doctors can wear anything. Sometimes the nurses, oftentimes nurses have a set color that they are responsible for wearing. Surgeons usually, you'll find them in like green scrubs or blue scrubs. But again, they can be dressed in, button-down shirts. Forget about trying to identify who is who based on what they are wearing, especially as a patient. If you work there, you kind of get a better sense of who's who based on what they wear. But if you're a patient, forget about it. Pay attention to their name badge, because on every single name badge, not only will it say their name, but it'll also say what their responsibilities are and their titles. I would be curious to know if there was anybody that I left off that should have been mentioned. Pop of my head, I left off the environmental specialists. How could I have forgotten them? They are essential because they help us keep the emergency department clean, and the ED can get really dirty really quickly. So they are an essential member of our team, and you'll find them walking around the emergency department and basically helping us to clean rooms, also known as flip the rooms, so that when one patient leaves, it's safe to bring another patient in there. If there's anybody else that I left out, please let me know. Put a comment below. I hope this video is helpful. I hope that next time when you come to the emergency department, be it a small community hospital, an average community hospital, or a major academic institution, you have a better understanding of the roles and responsibilities of the team players in the emergency department who may be entering in and out of your room throughout your stay. And until we meet again, I hope that you stay safe. Take care.
Got nothing else to tell. Subscribe and hit the bell. Smash that like button. Dash and stop frontin'. Until we meet again, yeah, share it with a friend. Dr. JB is my name and medicine is my game.